Hello, my name is Kari Sloat, and today I will be presenting on policy and advocacy for vulnerable and underserved populations in rural Idaho. This presentation analyzes Medicaid prior authorization barriers and telepsychiatry expansion as advanced nursing practice issues affecting psychiatric mental health nurse practitioners' practice. I will discuss the clinical impact, ethical considerations, implications for PMHNPs, and strategies to improve equitable mental health care delivery. Rural Idaho faces significant mental health care challenges. Much of the state is geographically isolated with limited psychiatric specialists and long travel distances for care. Medicaid utilization management strategies, such as prior authorization and step therapy requirements, often delay access to evidence-based psychiatric medications. These barriers disproportionately impact vulnerable populations, including individuals living in poverty, those with severe mental illness, and those with transportation limitations. In many rural communities, PMHNPs serve as the primary psychiatric provider. Therefore, policy decisions directly influence our ability to deliver timely and effective care. Utilization management policies are designed to control costs. However, in psychiatric care, delays in medication approval can have serious consequences. Interruptions in antipsychotic or mood stabilizing medications increase the risk of symptom decompensation, psychiatric hospitalization, and suicide. For patients with persistent severe mental illness, even short treatment delays can destabilize functioning. Telepsychiatry has emerged as an important strategy to reduce geographic disparities. Totten and colleagues in 2022 found that telehealth guided communication improves rural access to continuity of care. Additionally, Phillips in 2022 emphasizes that advanced practice nurses play a central role in advancing health equity through policy engagement. This issue is not just administrative, it directly impacts patient safety, outcomes, and the scope of advanced nursing practice. Ethical and practice implications. This issue raises important ethical concerns. The principle of justice requires equitable access to health care regardless of geography or socioeconomic status. Rural patients should not experience delayed treatment because of systemic barriers. Beneficence requires us to prevent harm. When policy delays evidence-based psychiatric care, harm becomes a foreseeable risk. The American Nurses Association Code of Ethics affirms nurses' responsibilities to advocate for social justice and improved access to care. Stigma also remains a barrier in mental health treatment. As described by Knack and colleagues, vulnerable populations often experience layered disparities due to poverty, rural residence, and mental illness stigma. As PMHNPs, our ethical obligation extends beyond direct clinical care to systems-level advocacy. Plan to advance healthcare delivery. To address these barriers, PMHNPs must engage in intentional advocacy. First, legislative engagement to reduce prior authorization and step therapy requirements for evidence-based psychiatric medications is essential. Second, supporting telepsychiatry, reimbursement parity, and regulatory support can ensure sustainable access to rural patients. And third, promoting rural broadband investment is necessary to ensure telehealth infrastructure reaches these underserved areas. And finally, expanding integrated behavioral health within primary care settings can improve early intervention, reduce stigma, and strengthen care coordination. Through leadership in professional organizations and interdisciplinary collaboration, PMHNPs can help advance equitable psychiatric care across Idaho. Conclusion and questions. In conclusion, Medicaid utilization barriers and rural psychiatric workforce shortages contribute to significant mental health disparities in Idaho. Ethical principles and professional standards require PMHNPs to engage in advocacy to improve access and equity. By participating in legislative processes and promoting telepsychiatry expansion, advanced practice nurses can help transform mental health care delivery for vulnerable populations. I'd like to disclose with these two discussion questions. 1. How can PMHNPs effectively balance clinical workload with policy advocacy? And should prior authorization requirements be eliminated for psychiatric medications and Medicaid programs? Thank you for watching my presentation.